I wanted to talk to you a little bit about the evolution of some of the technology. We know that technology and medicine are very integrated with each other. Now, when you first started in your practice, I'm sure the pacemaker technology was at a level that it's not at today. Can you talk to me a little bit about the evolution of the pacemaker from where it was to where it is today?
Yeah, so I've been doing this for about 30 years, and probably put my first pacemaker in about 30 years ago.
Okay.
And obviously the devices were much larger. The technology of the leads was much different then. The longevity of the devices was much less so then. And so that started about 30 years ago. We didn't have any kind of sensor technology, which if we want to supply what we call physiological pacing to a patient, we're trying to reproduce what the electrical system of his heart does. And the most physiologic pacing is if we can pace the top of the heart and let the conduction system of the heart do the rest of the job. So if the patient just has a slow heart rate,
right,
but intact cabling, intact conduction from the top to the bottom of the heart, we can pace the top of the heart. The thing about the top of the heart as compared to the bottom, it's a very thin structure. Electricity travels through it very quickly without the need for a specialized conduction system. So you can pace anywhere in the top of the heart and achieve the same kind of contraction that a normal heartbeat gives.
Okay.
The bottom is totally different. If we pace the bottom of the heart, the ventricles, where the main pump function is, from one point and let it travel to the rest of the heart, it would take a much longer time to travel compared to the normal heartbeat. So there's a specialized conduction system at the bottom of the heart that we are not able to reproduce with pacing. So that's one part that we can improve on, and we're still trying to improve on. The second part is in patients that we're pacing and are dependent on pacing or have a fixed heart rate. How do you change that rate from a resting heart rate to what they require when they're exercising?
Right.
And that technology has evolved a lot. So we are able to put sensors in the pacemaker that either detect motion, activity, or some other physiological parameter, and are able then to, through an algorithm, increase the heart rate to try to match what a normal heart under that influence of that kind of activity should have.
Right, and those are the rate adjustable pacemakers.
Rate adjustable pacemakers.
Is that the state of the art that we have right now?
Well, we have a lot of different sensors that there probably some room for improvement, but pretty much we've garnered most of what we can.
Right.
From what available technology we have right now.